Hello, I am Dr. Williams, and this lecture we will be discussing some of the models and theories within nursing. So let's get started by first identifying what are the objectives that we will cover in this lecture. In this lecture, we will contrast some of the early philosophical perspectives of nursing theory, looking at theorists such as Nightingale, Henderson, and Abdella. We will also compare the communication and relationship models of Travelby and Paplow. We will discuss the approaches for applying these selected nursing models into practice. Then we will look at comparing and caring and culture models according to Watson, Linenger, and Campina Boccodi. And then we will also look at some of the models of Newman and Roy, and we will contrast them. We'll conclude this lecture by looking at the theorists Oram and Schuler. So let's first get started with Florence Nightingale herself. And we will start with giving you a background of Florence Nightingale.
Florence Nightingale
So what I would like to do now is, as you watch that video, I want to kind of highlight how we should be looking at theorists, such as Florence Nightingale. What are some of the key aspects that she has contributed to nursing, as well as understanding what is important for any individual who is a theorist, particularly a nursing theorist? First, it's the background. As you watched the video, you heard a lot about Florence Nightingale's background and her impact in nursing. Next, it's the concepts. What concepts does her theory embody? It embodies concepts such as nursing, health, environment, and person. And she defined them clearly as they apply to her theory. She also had some assumptions. And when we talk about assumptions, we're talking about those things that she assumed going into the theory that she has developed. One of those assumptions would be that a nurse may be any woman who had charge of the personal health of someone else. Another assumption was that she believed that nursing is a calling or it's God's work. Florence Nightingale also assumed that disease was a reparative process if proper nursing were to allow for healing. And a final assumption I want to speak to is that nursing is based on compassion, observation, experience, statistical data, sanitation, nutrition, and administrative skills. But in this theory, you also see its usefulness. What and how was this theory applied? It was applied to things like cleanliness, both for the environment as well as personal cleanliness. It also was how to avoid certain things such as noise, petty management, and things of that nature. They are all included in her theory. Now we are going to transition and talk about Virginia Henderson, and we're going to do it from the same four perspectives as we did with Florence Nightingale. So as you listen to Henderson herself speak, she had some key concepts and points that she made clear. One is that nursing, we provide care to a patient, the care that they would want to receive. Two is that our job is to help them get to a state of independence or regaining their abilities as soon as possible. And that is based off of the knowledge and the skills that we have combined with the care that we provide. But I love that she also transitions and says, nursing is more than just carrying out orders, but we do partner with our medical colleagues in the care of diagnosing and treating our patients. So let's talk about some of those principles that Virginia Henderson has, right? When you look at her background, she was a well-known educator. She was definitely a prolific author, right? And she created some basic nursing curriculums for the NLN. Some of the components within her theory, as you can see here, we want to help those patients regain some of these abilities and skills, right? Those are some of the components that she speaks to. Some of the concepts, just as you saw in Florence Nightingale, nursing, person, environment, and health. And you can see how Virginia Henderson defines these principles according to her theory. And when you think about the assumptions that Virginia Henderson had within her theory, she says nurses care for patients until patients can care for themselves once again. Patients desire to return to the health, but this assumption is not explicitly stated. Nurses are willing to serve, and that nurses will devote themselves to the patient day and night. And her final assumption is that nurses should be educated at a university level in both arts and sciences. So those are some of the assumptions at the foundation of Virginia Henderson's theory. Now let's talk about a few of the usefulness things about her theory. Concepts of foundational human needs, biophysiology, culture and interaction. She does utilize also like the Maslow theory, right? Her definition and components are logical, and the 14 components are a guide for the individual and nurse in reaching the chosen goal. And it's relatively a simple but yet generalizable theory. And then her ideas of nursing practice are well received and utilized as practitioners guide their practice. We're now going to move to the theorist Faye Glenn Abdallah. Faye Glenn Abdallah was born in 1919. She has a patient-centered approach to her care, which means that they develop inductively from her practice and is considered a human needs theory. The theory was created to assist with nursing education and is most applicable in the education of nurses. It does have some relevance with hospital and community settings as well. And it provides nurses with one of the first academic nursing theories. And we use the term first of nursing diagnosis from Faye Glenn Abdallah. I like this theory because I worked at the Uniformed Services University of the Health Sciences up in Bethesda, Maryland. And that university was a development from Faye Glenn Abdallah. So now let's talk about the background and the concepts, the same components of Faye Abdallah's theory as we did with Florence Nightingale and Henderson. So when you look at the background, Faye Abdallah recognized the nursing problem of the patient and decided to use an appropriate course of action to take in terms of relevant nursing principles. Her background was to instruct nursing personnel and family to help the individual do for himself what he or she cannot do within their own limitations. Kind of sounds familiar to Henderson, correct? and helping the individual to adjust to their limitations and emotional problems. And working with allied health professions in planning for optimum health on local, state, national, and international levels, as well as carrying out continuous evaluation and research to improve nursing techniques and to develop new techniques to meet the health needs of people. So you can see how Faye Abdalla's theory and some of that background of her theory is grounded in her belief about education and preparation and how it's used in the educational setting. So now let's look at some of the concepts and assumptions for her theory. So when you look at her concepts, and again, the 4 same concepts that you had from the previous theories, but I want you to look at how she defines them and compare those to how both Florence Nightingale and Henderson defines those same concepts. Some of the assumptions with Faye Abdalla's theory is learn to know the patient, sort out relevant and significant data, makes generalizations about available data in relation to similar nursing problems presented by other patients, identify the therapeutic plan, test generalizations with the patient, and make additional generalizations. Continue to observe and evaluate the patient over a period of time to identify any attitudes, clues. So as you can see, every theorist has their concepts, they have their assumptions, and then we can move on to the usefulness of their theories. So Faye Abdalla's usefulness is that it's problem-solving approach with key nursing problems related to health needs of the people. She has 21 nursing problems that were developed from this framework. It provides a basis for determining and organizing the nursing care, and it provides a basis for organizing appropriate nursing strategies. Within this lecture, this PowerPoint slide, you can click on the link and you can see the university that I was telling you about in the military, some of the things that they've done. And there is grants that still exist because of Faye Abdalla that can be awarded for individuals who would like to do research in nursing. Now let's talk about Betty Newman. Betty Newman was born in 1924. She had a bachelor's in nursing, which she acquired in 1957. She had a master's in mental health, public health consultation, and her PhD was in clinical psychology. Her theory was published in A Model for Teaching Total Person Approach to Patient Problems, and that was in 1972. And then there was also a conceptual model for nursing practice in 74, and then the second edition was in the 1980s. I bring that to information into this lecture to remind you that knowing the background of theorists is important. What did they contribute to our profession? So when we think about her systems model, you can see here the different components that are included in her system models. It goes from things like content, which is a variable of the person in interaction with the internal and external environment that comprise the whole client system. She talks about things like the basic structure, the degree to reaction to stress, things like flexible level of degree of orientation. She talks about inputs and outputs, prevention, reconstitution, and stability. She has several components within her systems model. And we talked about her background, but when you think about the background of this theory, we're talking about a systems model that provides a comprehensive, flexible, holistic, and system-based perspective in nursing. Those concepts we already talked about that she has within her theory. And then what are some of the assumptions? Her theory assumes that each client system is unique. It also has the assumption that many known and unknown and universal stressors does exist for every individual. There is also the assumption that the particular interrelationships of client variables at any point in time can affect the degree to which a client is protected by the flexible level of development against possible reactions to stressors. So you can see that she has several assumptions within her theory, right? And when you think about how she defines her concepts, you can see that here when they talk about the client, primary prevention versus secondary prevention versus tertiary, and then also versus the client as a system. These are all other assumptions for Faye Abdallah. And you can take a moment, stop the lecture, and just read and review and understand what she means by these assumptions. So we're now going to transition a little bit to Betty Newman, right? And when we talk about Betty Newman, the usefulness of Betty Newman's system is the model provides a comprehensive, flexible, holistic, and useful, a holistic and system-based perspective in nursing. Newman's model focuses on the response of the client system to actual and potential environmental stressors, and the use of primary, secondary, and tertiary nursing prevention, right? And those are some of the usefulness when it comes down to Newman. Now, if you look at Newman's theory and you compare it to Roy's theory, okay, I want you to look at these diagrams that you have before you. And with Newman, you have a basic structure, energy of resources. That includes things such as your normal temperature, your genetics, your organ strength or weakness, your ego structures, and things of that, the known commonalities, right? And then we have these lines of resistance as you start to go out of that diagram. You have lines of resistance, then you have your normal line of defense, and then you have your flexible line of defense, those things that change, that can be that can waver one way or another, right? So you have your basic structure, and then you have how much you can actually manage within that basic structure. However, once you extend outside of that, we then get this manipulation because of the flexible defenses that are there, okay? I want you to think about, if you look down to the notation, we're talking about like physiological, psychological, social, cultural, developmental, and spiritual variables that occur and are considered simultaneously at the same time of the patient's concentric circle. So yes, they have their basic core, but there are so many external factors, which can be psychological, sociocultural, developmental, spiritual, that can impact the core. And so as a nurse, we need to understand that and then see how we can utilize those to help patients in their journey towards wellness. Now let's transition to Roy, who says we have these coping processes at our core, right? And within that core, we have an overlapping of things like the psychological, the self-concept, the interdependence, the role function. We have all of these things that are interconnected and that impact what we do and how we do it. And thus, we as humans, we have to adapt to that. And when we can do that successfully, we can have a state of wellness, right? If not, we as the nurse can help the patient to adjust these different interconnected concepts so that they can get the best wellness. Okay, so that's the difference. So when you look at Newman, it seems like there's self-defined lines, although we have these same sociocultural, developmental, spiritual. Whereas Roy is saying, yes, we have all of those same concepts, but they're so intertwined and interplaying all at once. And we have to look at all of them because it could be different things that are impacting you as a patient. And then with that, it also impacts what your coping processes are. Some of the things I like to highlight is that if you think about it, it's saying that individuals, for Roy, the assumption is that individuals have that coping process. What happens when you have an individual who doesn't have good coping processes or strategies? How do you help them to develop that so that when they have all of these intertwining concepts, that they can adjust accordingly and gain the maximum wellness that they can? So now let's talk about Orem. The purpose of Orem's theory is that nursing is seen as an art through which the practitioner of nursing gives specialized assistance to patients with disabilities, which makes more than ordinary assistance necessary to meet the needs for self-care. The nurse also intellectually participates in the medical care of the individual and they receive from their physician. So it sounds a little bit familiar when we think about Henderson, who said, nurses do not practice independently of the medical profession. We are collaborators and we work together. Some of the concepts within Orem's theory are concepts such as self-care requisites, universal self-care, developmental self-care, health deviation self-care, therapeutic self-care. So I think you get the point. Her theory is really focused on self-care, right? And how do we assist when we think about the nursing theory, and how do we assist our patients with this, right? Because we have, if you look at the diagram here, someone who has wholly compensatory system, and then we have things that help with that for them to be wholly holistic or complete or well, shall I say, would be the support and educative system. It also takes compensatory systems. It takes self-care. So all of those things is what contributes to a patient being whole and having wellness, according to Orem's theory. Now, when we look at Schuler, the nurse practitioner model, I like the model, and I like to just be able to reiterate this, and I believe we discussed this in a previous lecture. The purpose of the Schuler nurse practitioner model is to integrate essential nursing and medical orientations to provide a framework for holistic practice for nurse practitioners. Again, you hear this reverberating tone from the theorists of how nursing collaborates with our medical colleagues. Some of the concepts of Schuler's model is patient and NP inputs. That's the things like the episodic or comprehensive, with or without health problems. The data gathering and the role modeling. Patient and NP thought puts. And what that is identifying the problems and diagnosing, contracting and implementing those contracts, and planning and implementing an appropriate level of care. And then this model also talks about outputs. It's the comprehensive evaluation of the patient and the NP's outcomes. So now that we have reviewed those models, take some time to look back into your text and read more about these theorists and kind of help to solidify your understanding of their theories. What is the background of these theories? Why can they speak to us as theorists and we accept that? What is the concepts that each of these theories are talking about? What are some of the assumptions the theorists give? Because it's important to know the assumptions, because the assumptions helps us to see where we may need to make some adjustments, because not all things may be according to the foundation in which the theorist originally thought, right? It's not solid that every person has this, or every nurse has this, or every patient is able to accomplish this, right? Or even every educator, because many of these theories also apply to us as educators. The next is, what is the impact that the theory has had on the profession of nursing, on healthcare, and on our patients? So this concludes this lecture, and please take time to review and read in your textbook. You can also utilize the literature. There are lots of research articles about these theories that may help to also enhance your knowledge of how these theories are actually applied in the clinical arena, which is also very important. Just knowing the theorist is not the extent of what we need to do. How do we apply the theory to practice? And how do we allow the theory to guide us and how we provide evidence-based guideline care to our patients for best outcomes for the patient and healthcare system?